So we're recording. Thank you, Olya. Nice to have a chance to come into this community psychology class. It's very exciting to kind of have a chance to do this by Zoom, which we can record. And the class has asked me to answer a couple of questions. How did I learn about community psychology, and what drew me to the field, and what's the favorite part of being in this field, and how does one work with different partners, and how does one pursue a degree? So those are some of the questions that have been asked, really great questions. And yes, I've been working in this field since actually the early 1970s, so over 45 years, and as a graduate student before that. I was very fortunate to go to a graduate program at the University of Rochester that was just beginning the field of community psychology. So I, as a first-year student, had a chance to meet all the people who were starting the field because they came by the University of Rochester and were colleagues of my mentor, who was Emory Cowan at the University of Rochester. So over the years, I have been increasingly interested in policy. And that's what got me interested in being a psychologist versus being a lawyer. I wanted to be able to bring about change. And actually, what I've found is that during my time of working in the field, I've had chances to talk to many students who have asked about how does one get involved in policy work. So what got me interested in being in this field was I had a chance to really make a difference. And I think that's really what everybody was saying as they were kind of describing some of their interests at the beginning of this class. So let me go through a couple principles that I found helpful to me, and maybe they'll be helpful to you for those of you who want to go into different types of policy work. I think the most important thing is to stay with an area. It's almost like an archaeologist or an anthropologist. You're digging deep. You're getting to know the customs, the values, the norms, the history of a particular issue, problem, or people. And you really need to be there for a while. You've got to know the ins and outs. You've got to know who the players are. You got to know where the vulnerable places are. So the question is, how do you stay with something for a long period of time? Could be 5, 10, 20, even your whole career, 30 or 40 years. And I think you've got to find something that really moves you, really you're passionate about, something that you really want to work on. And I'll give you kind of an example. When I came to DePaul University, I came here because it was one of the first clinical community programs in the country, started by Edwin Zolik in about 1966, 67. So we really started this program with Ed Zolik right when the field was starting. So it was exciting to be part of that. And my tenure over the last many years, I've been helpful, been able to get creative in terms of helping develop the undergraduate concentration that you're in with Olya, a graduate concentration in community psychology with Joe Ferrari, and also we have now a master's program, a combined BA-MS, as well as a independent master's in community psych. And I might add that we are the only program in the world that has an undergraduate concentration, a master's program, and a doctoral program in both clinical community and community. So that's a rich territory of basically undergraduates, master's students, doctoral students, and being involved in one setting for a long period of time, I've been able to be active in the creation of all those programs as one team player. So by being in one place, sometimes we're always trying to change the world, but it's just as important to think about our own setting. How do we enrich it? How do we create opportunities? How do we make it more possible for people to get trained in it? So I would say whatever setting you're in, use that as your laboratory to create change. Don't just think about change as something that happens to the environment in the community and outside the social setting or college, university you're in. Make it part of your day-to-day existence. So the first principle is find something you really care about. I was passionate about really training people who wanted to be in this field. So I was able to host myself at one setting. I didn't go from one setting to another. I just stayed right at DePaul my whole career. And I was able to help build that infrastructure. So passion, stay committed, keep invested, stick with it. And that's probably the most important thing, I think, in bringing about policy change, because you have to be there long enough to be able to bring about these types of changes. The second thing that I wanted to emphasize is that often the work that we end up doing is kind of like a Band-Aid approach. It's just kind of like a cut that you put a Band-Aid on, and hopefully it won't fester and get infected. But often it's not really dealing with the tragedies that are causing the wounds in the first place. It's often caused like first order change. But we, as community psychologists, want to be involved in second order change. We want to be involved in changing the roles, the features of our interactions with environments. We want to be involved with changing the status quo, things that basically possibly prevent rather than just end up treating problems. So to the extent that we want to be involved in second order change, we have to be in that change for a period of time, have to stay connected with it, and really have something that wants to work on. And let me give you a quick example. For many years, I was interested in tobacco and how so many people lose their life because of tobacco. Actually, over 350,000 people die because of tobacco-related deaths. And it's because of all the chemicals and all the products and the nicotine. So for me, that was something I was really passionate about. So I focused on trying to go into schools and to develop programs for kids to basically learn skills so that they would say no. They would not get involved in tobacco. They would basically learn the social skills to resist the peer pressures to smoke. That was important programming, but it was focusing on kids that were in schools, in communities. And when I listened to the youth in the 1980s tell me that the prevention programs that I was mounting were contradictory to the fact that they could go into any supermarket, any grocery store, any pharmacy at 12 and 13 years of age and purchase tobacco. So to me, having that mixed message basically undermined, in some ways, the prevention program. So I shifted my attention from just focusing on the youth to actually focusing on the communities. And how about getting the merchants to stop selling minors tobacco? And actually, your instructor, Olya, worked on some of those investigations over 20 years ago. So I appreciated her work on that. And we worked on that for a long time. And we first worked in Woodridge with a police officer named Buzz Talbot. And we were able to demonstrate by sending people into stores to purchase them. And if the youth got purchased tobacco, they would get consequences, fines, and possibly the loss of their license to sell tobacco products. And we were able to show that from over 70% of stores selling tobacco, we could stop all merchants from selling tobacco relatively quickly. That lesson actually had spillover effects, because when we looked at the junior high school before and after this intervention, we actually got a sizable drop in tobacco use among the junior high school students. And the officer that I worked with, Buzz Talbot, went to Washington, became an expert in this field, and he actually helped pass something called the Sinar Amendment, which replicated the work that we did in Woodridge so that policy was developed across every state in the country that they had to show that they could reduce youth access to tobacco. So one study, Woodridge, ended up having policy implications with an amendment to federal regulations that has become law throughout the world, or at least the United States. And certainly other things need to be focused on now, not just tobacco, but other things that youth are getting access to, as we know, with the electronic cigarettes. But you can see, focusing on one piece, thinking about first order versus second order change. Second order change was changing the relationship of the individuals and their communities, the individuals and the retailers. So here I am, a psychologist, and I'm working with trying to get retailers not to sell minors tobacco. So you can bridge your fields of interest and work with police departments as well as work with cities to bring about change by just bringing the relevant people together. But we worked on this for over 20 years. So you can see that long-term effort to really get to know the critical players was important in bringing about policy change. So let's go to the third factor that often occurs, and that is whenever one tries to bring about second order change, whether it's with homelessness issues, with tobacco, with other types of things, including poverty, you're going to find that there's lots of people who actually prefer the status quo, don't really want things to change. And that's probably what burns out more budding clinical community and community psychologists than anything. Because with all the idealism and optimism, one goes into the field, one tries to bring about important second order change, and one has no idea that there are so many obstacles that people don't want to change, often in highest leadership positions, because they're comfortable. So the question is, you need to figure out ways of getting to them, and it's not going to happen often quickly. It might be involving a long-term process. So with the tobacco industry, that was our foe with these tobacco studies. And we had to recognize that to get them to change was going to be a multi-pronged effort. And we couldn't do it alone. We had to do it with many different collaborations. In this case was the police department in Woodridge, but we also collaborated with the Chicago Lung Association as well as other places. So again, it's networking, and that really brings me to the next critical issue, and that is if one's going to deal with those powerful forces that try to stop us from bringing about change, so that second order, we stick with it for long enough, ultimately, the way it's going to happen is frequently by mobilizing other coalitions. So it's not just yourself, it's really working with community groups and organizations, working with police departments, working with policy people. So no one does things generally for oneself to bring about important changes. So ultimately, what I'm suggesting is to bring about big changes in policy takes a long time, takes a real strong commitment, focusing on that second order change, dealing with the powerful others, tobacco industry and others who don't want to bring about that change, and also to basically mobilize coalitions. And just giving you an idea of those powerful forces, the retail associations, they didn't really want to stop selling tobacco to minor because they got a lot of their resources and funds from that. The retail stores didn't want to stop selling them. So there were lots of forces that were trying to prevent the change. But eventually, we were successful in getting that change implemented by, in some ways, being able to mobilize resources to bring about these changes. The fifth thing that I have sort of realized is very important is that really we can, in some ways, work with multiple methods, qualitative, quantitative, you've probably heard that, mixed methods. So we can have a whole host of resources that are tools, and they're different ways of gathering data, different ways of trying to understand the phenomena. And the more different ways you have that information, the more you can ultimately convince policy people to bring about change. So as an example, we were trying to bring about legislation in the early 1980s that involved youth, really, who weren't in automobile restraints, didn't have safety belts on in their cars, or weren't on infant seats. 95% of youth were not carefully protected in cars. And actually, it was the leading cause of death among youth, car accidents. Because if you're trying to hold a baby and you're going 25, 30 miles an hour and you have an accident, it's like dropping that baby from a 3-story building. That's what was maiming most infants and youth. So how do you bring about change? Well, we put people on street corners to look into cars, to see, just collect basic data. Were people in appropriate restraints? So that was one method, direct observation. Another method was we called citizens and we asked them, do you think it's important to have legislation so that we protect kids? Well, what we found was that the majority of people were not in restraints for their children or youth. And what we also found was that most people backed legislation. They wanted it. So when the legislature at the Senate and representatives in Illinois was passing a particular bill, we sent our material to those legislators. And we found that by sending that material of different observations, self-report, and a one-page information, we could actually sway the voting patterns of the people who got our information. And the bill actually passed in the early 1980s in Illinois. And we were able to chart that before the bill and after the bill that required parents to put their children in appropriate restraints or infant seats, there was a significant decrease in fatalities. So again, you can see how multiple methods was used with a particular organization that was trying to bring about change, that we provided that information to this organization that was lobbying for change in Springfield. And we were able to get that change. And our data was actually told to us was the most important thing that swayed the legislators to actually adopt it, this new legislation. Multiple methods. So let me try to summarize again these basic principles and just use another example of something we've worked on for many years, which is recovery homes. And particularly with this time of COVID-19, boy, when you think about recovery homes, they're a pretty important place. They don't get a lot of attention, but they really are something in the community because they're everywhere. There's over 250,000 people today living in recovery homes across the United States. They're in every city, every state, every local area. Who are these people? Most of them have episodes of homelessness. Most of them have criminal justice involvement. They've been in jail and prison. Most of them have psychiatric comorbidity, a lot of depression, anxiety, and they all have substance use disorders. So just think, you've got a whole sample of people who are at risk for having COVID-19 infection by this new virus. So the question is, where do these folks go? You know, if you talk to people coming out of jail and prison, what do they say? Housing insecurity is their biggest problem. They don't have places to go that are stable, that are safe. Well, these particular recovery homes around the country are actually setting up rooms within them. So if someone tests positive for the virus, they can be quarantined right in the house. There's other houses that are basically self-quarantine when something happens, the whole house. there's other houses that are doing all types of other practices. We have two unbelievable recovery homes in the Squamish tribe outside of Seattle, Washington, where the tribe owns the houses. They're for Native Americans, but there's also non-Native Americans on the houses. And the male and the female house gave their rent to the tribe this last month. And the tribe said, no, you keep it. You've got enough issues. Just focus on staying well. I mean, that's a relationship with the community and these recovery houses. It's amazing. So recovery houses are something that's very important. And I got involved in working with recovery homes about 30 years ago. And in particular, I focused on one group of about over 2,000 houses, which house over about 25,000 people right now. And they're called Oxford houses. And you might have heard of some of them, but most people have never heard of them. And yet they're in every state. There's 50 of them in Illinois. And there's 3 rules that these Oxford houses rule by. One is you can't take drugs or alcohol or you're evicted. 2 is you have to pay your fair share of expenses, which might be about $100, $120 a week. And 3, you have to go along with the house rules. So everybody in the house has different jobs and responsibilities. So it's an interesting place to live because everybody is in recovery. People are going to 12-step programs to get support outside the house. People are in an environment where their social networks are basically non-using, abstinent, and they're working, and they're not involved in criminal activity. So think of it. If you come out of jail or prison or substance abuse treatment setting, where would you rather go? To the streets, to a shelter, to a single room occupancy, a place where you're basically, your best friend is off in your television set? Or would you rather be in a community where people care about you, are rooting for you, are helping you get a job, are helping you stay abstinent? If you're interested in community, then these types of recovery homes, Oxford houses, are pretty neat places. And you know, one thing about these Oxford houses, there's no professional staff. It's all self-run. So it doesn't cost society money because it's, in a sense, it's solving the problem among the community themselves. So I got involved because I thought to myself as a community psychologist, what a wonderful laboratory to work in. I mean, I have access to my interactions with these people, and I thought this would be kind of a pretty good way of trying to think about systemic change that's not just first order, that's second order. It's not just putting people into a group of once a week group therapy or group supervision. It's having the social setting changed so that you have a place where you can actually get fellowship, get support, get abstinence support. And that, to me, was a very convincing thing to stick with. So I've been working with it for 30 years. So it just kind of shows if you find something you really care about, you'll really stick with it. And you know, how did I get involved? I saw this guy, Paul Malloy, who created it in 1975 from one house to about 200 houses in 1990. I saw him on 60 Minutes. And I called him up the next day and I said, hey, Paul, I'm Leonard Jason, community psychologist at DePaul University. I'd like to work with you and help evaluate the recovery homes. He said, great. And that started a partnership over 30 years. So again, sometimes it's very unusual how you start these partnerships. But you know, when he came to Illinois with his Oxford houses, we spent about a year just sending our people into the 11 houses at the time to get to know them, their business meetings. and they sent their representatives to our research meeting. So we got to know them. So it's really a collaboration that was occurring before we even collected any data. So again, if you really want to get to know these individuals, you've got to dig deep. You've got to get to know them. You can't just go in, do a quick study and leave. It's not going to work. It's not going to end up developing those long-term relationships or really knowing all the issues that possibly could be available that you might want to work on. So when I worked with Oxford House, I said I was going to do some grant writing so that we could find out how it worked and why it worked. And we wrote grants to the federal government. One grant after another grant after another grant weren't successful. Why? Because people in power. We were trying to bring about second order change. I was committed to it, passionate about it, but people in power didn't want us to get the money. Why? Because we were going to suggest that possibly you could go into these recovery homes and get recovered yourself without very expensive types of professional treatment. So we had people on our review committees who weren't the happiest to basically see us suggesting that recovery is important in the community. You've got to create resources and supports there, and that's where the action is. But they were much more interested in 28-day treatment programs where they have complete control, and it was very hard to get these grants. So what they said to us was, you have to basically do a randomized study. Some people get it, some people don't. That's the only thing we'll support. That's what they said to us. You know, and I said to myself, how do you do a randomized study with a community-based organization? So remember, we said methods are important. You gotta have good methods, but that method we didn't think was a fit for a grassroots organization. And each house has to vote people in. You have to get the majority of the residents to say, we want this new person to come in. It's like a family. So we said, how do you do a randomization with that? So after trying multiple times to get funding, I finally told to Paul Malloy, who was the founder, and I said, we're probably not going to be able to get this grant because we can't do a randomized study. And he said, we're going to do it. So you see, those years of doing pilot work, of developing a relationship with the organization paid off because he helped us actually do a randomized study. He said, well, we'll bring a person to one house. If they don't get voted in that house, we'll bring them to a second or third house. So we did that. And we actually showed that we could bring 75 people coming out of treatment into a house, one or more houses, and 75 didn't. And 2 years later, we could show that substance use, criminal involvement, employment were drastically different if you had that support. 2 years later, very good outcome studies. So we got opportunity to be a community psychologist, to use an innovative design because of our relationship with this organization that helped us bring about second order change, that helped us defeat those power brokers who didn't want this grant to get funded, that used a very innovative method that we didn't think was possible. And that research ultimately was used by the organization to get special status within the federal government, that it actually was proven to work. It was validated intervention. So by then getting the seal of approval of the federal government, because we had data to suggest it worked, they then were able to expand their network from a few hundred houses to a few thousand houses. So you can kind of see, in a sense, what we're doing with this. We're basically trying to create change, policy change, by using data in our relationships with these organizations to defeat those folks who are powerful, who basically often are trying not to allow us to do the second order change we want. But it didn't occur fast. It occurred over 8 or 9 years. It's a long-term process. And most of my efforts in the policy front have been long-term committed efforts, not short-term. So you've got to stick with something for a long period of time. Now, the interesting thing about the Oxford House, again, just talking about relationships, because relationships are in a sense, the foundation of all these policy issues we're talking about. How do you bring together relationships to either create programs at DePaul, to create relationships with Woodridge and their police department in Bell's Talbot, or to create relationships with the founder of a recovery home organization. Those relationships are critical. Let me give you an example. Years later, after we had done this study and published it in American Journal of Public Health, very prestigious journal, Paul said to me, you know, before you came to me in 1990, some other researchers approached me and they said, we wanted to do research with Oxford House. And they said they wanted to do a randomized study. And I told them, forget it. I'm not interested in working with you. I don't know you. I don't trust you. Think about how I approached the Oxford House organization differently. I approached them saying, I want to work with you. I want to get to know you. And I've got no idea what I'm going to do. I just want to develop a relationship. Very different way of approaching things. And over 7 or 8 years, because we had that relationship, then he suggested a very rigorous research design that I never thought would even work or be possible. Yet when another research group came to him much earlier without that relationship, he wasn't interested in working with them. So how we approach our work is so important, to do it in a way that's grassroots, that's respectful, that values good communications. That relationship allows for the long-term commitment. That relationship allows for our ability to work on second-order change. That relationship allows us to defeat those individuals who are trying to not allow these interventions to progress. And it's by using creative multiple methods, whether it's looking into a car, getting self-report data on seatbelt use, whether it's sending minors into stores to purchase tobacco, whether it's with recovery homes, sending people into some homes and not other homes. I mean, there are so many things one can do if one is flexible and creative and not somewhat narrow-minded. But that relationship is the weave that goes through all the different parts of policy work. Now, I know we're coming to about the end of this classroom session.